A lot of doctors go into dental sleep medicine with a skewed perspective on what that experience is going to be like. They have this almost this euphoric idea that every single patient you talk to about sleep apnea or signs and symptoms or the anatomical indicators that they're displaying during their hygiene visit, they're going to magically say, thank you so much for revealing this to me. And what do I need to do to move forward treatment? Here's my credit card. I don't even want to rely on insurance. Completely unrealistic. If you can go into dental sleep medicine, and this is one of the troubles I see in the industry, so many doctors, so many dentists fall off. They fall off the wagon when it gets hard. But if you can go into your dental sleep medicine journey with the end goal in mind, understanding that it's going to be difficult, understanding that there's going to be complications along the way, you're going to be able to push through those, knowing that once you get over those hurdles, once you get beyond those objections, beyond those staffing issues, once you get into, the troubles that you're having with your systems, all those things, when they're solved, you get to the green side of the fence. You find green pasture, and all of a sudden, you're where you had intended to be in your dental sleep medicine journey. But you only got there because you recognized that the journey was going to be difficult. So enter into this, if you're just getting into dental sleep medicine, enter into it with the expectation that it's going to be hard, but the promised land is incredible.